1,700 of us no longer have pension out of all of Kaiser's employees, so we are fighting to get that pension reinstated as well for all of us. Everybody else within Kaiser has that pension, and so we are fighting to get that reinstated.
We've got on the line now Jessica Rentz. Jessica is a licensed marriage and family therapist, and my position is an intensive care coordinator. She does management for high-risk patients who are referred to higher levels of care or stepping down from inpatient hospitalization. She is a member of the National Union of Healthcare Workers, and she does that work, the licensed marriage and family therapist and intensive care coordinator for Kaiser in Southern California. A member of the National Union of Healthcare Workers, a union steward, and member of the bargaining committee. Jessica, welcome to the Valley Labor Report. Thank you for taking the time.
Thank you so much for having me.
I am really excited to talk to you. My wife is a therapist. I told you that over email. And when y'all went on strike 2 years ago, or at least I don't know if you specifically did, your unit, but other Kaiser therapists did. She was like, y'all should get him on the show. And like other things happened, and I never did, and we never did a segment about the contract and how it was negotiated. And so she was like, why'd you never have a therapist on the show? Why'd you never do that? And so here we go. So Ryan, you're welcome. But also, I'm super interested in it because, you know, I'm a union member in a professional kind of union. I got a clickety-clack job, and the professional office work as well as healthcare work is work that a lot of people do not perceive as being union work, right? And so shedding light on stories of, you know, professional unions and healthcare unions is something that I am really passionate about because I want people to understand that anybody can have a union. Anybody should be in a union. If you work for a wage, you need a union. And so, yeah, so really excited for the conversation. And let's start with your work as your work personally as a mental health care worker and the work that your unit does. What do you do? What do your members do?
Okay, so again, I'm a licensed marriage and family therapist for Kaiser, as you mentioned. My position's a little bit different, so I'll talk mostly about what a lot of my colleagues do, and what I used to do for Kaiser. So we see patients. We see patients that come in, whatever they're struggling with. They have an intake, and then they're scheduled for whatever services they're needing. So whether that's individual therapy, group therapy. Medication support services, whatever they're needing, we're getting them scheduled for that. And so they're seen, whether it's in person, virtually, like kind of like we're doing now, or over the phone. And they're seen it depends on like the weight, which is one of our reasons that we are striking as well. But they're seen by their therapist for these sessions. What I specifically do, so I used to do that, and I stepped away about 3 years ago from that because the workload was just getting too much for me. So what I do now is, as you mentioned, I'm an intensive care coordinator. So I don't have a caseload of my own. I work with everybody else's patients who are needing that intensive care coordination. So if they're needing higher level of services than what we can provide within Kaiser, or if they've unfortunately been hospitalized and they're needing to kind of step down into lower levels of care before they return to Kaiser, I'm helping manage their case managing for them to get them the care that they need at that point.
Gotcha. And so do you have among your unit like people who do kind of the traditional, like you think of a therapist and they're sitting on a couch and like talking about, you know, like that kind of clinical therapy? Do people in your unit do that kind of work?
Yes, absolutely. And a majority of the therapists that we have at Kaiser, that is the type of work that they do. They do the back-to-back, the return therapy. They're working on goals and helping our patients, improve, manage whatever they're going through. So yeah, a majority of the therapists that I work with do that return therapy. Absolutely. And I did want to mention too, that outside of the therapist, so our therapists make up a majority of our union in Southern California for NUHW for Kaiser. However, also in our bargaining unit is our psych RNs. So these are RNs who are working specifically with our psych patients regarding medication issues. They're assisting the doctors. We also have medical social workers who are helping our patients in the hospital and different levels of like medical care. And then we also have care at home, social workers as well who are assisting patients who might be on hospice or palliative care. And then additionally, I don't want to leave out our psychologists as well. So they are doing testing for our patients, treating our patients in whatever ways they need to be treated as well. So outside of the therapy, there's also all these other members that are along with us in this crazy ride right now.
And so before we start, y'all are on strike right now, and you have been actually for like 2 or 3 weeks. It's been a while. But before we get to that, can you explain, talk to some of that, the people who kind of see mental health or healthcare work in general, hospital work, professional work, as not the type of work that should be unionized. Why are you, as mental health workers, unionized? Many of these folks are non-union nationwide. Why have y'all chosen a different path?
So it's extremely important, like you said earlier, it's extremely important for everyone to be unionized, right? But specifically for mental health, it's very important. One, for the reasons that we're fighting for in this strike, we're fighting for equity for and parity for our patients, as well as for our workloads and for our workforce, right? So as far as for our patients, we're standing up against, Kaiser in a sense to make sure that they're getting the care that they need in a timely manner. And so we are kind of, in a sense, the whistleblowers when this is not happening, because there's a difference between quantity and quality of care, which is what we're standing up, for. So it's extremely important to have the union involved in that. So we have that platform, that voice to stand up for these patients. And then on the other side, for our workers who are having these, unfair workloads, not the time that they don't have to provide this quality of care for their patients, or, just to make sure that our contract that we sit with management at and bargain for is being followed by both sides, but we're making sure that it's being correctly followed and our workers are protected. So it's extremely important for our patients and our workers to be unionized.
At least here, many therapists work for like small nonprofits, not large conglomerates. I don't know if that's the right word for like Kaiser in California.
Yes.
Is there a precedence in California for unionization of these smaller nonprofits too?
I mean, I would say so. Yeah. I mean, whether you're working for Kaiser, like you said, the giant conglomerate, or little, smaller return mental health clinics, I would say that it's important across the board, because we're finding a lot of people that are seeing our platform, are seeing our messages as far as like the issues that are going on with Kaiser, are saying, hey, I don't even see a therapist at Kaiser, but this is also going on at other clinics. And so the importance of having enough staff wherever you work to provide that quality of care, it's extremely important. So whether you're a 5-person team or a thousands and thousands, person team, it's so important everywhere.
And so you've touched on some of them already, but let's dig into a little bit more deeply what the issues are at negotiations. Y'all are obviously negotiating with a company. I don't know if negotiations are stalled or paused right now due to the strike, or if you are currently at the bargaining table. But what are the issues, and where is the union and the company on these issues?
So just to give you a little back information, we started bargaining with Kaiser regarding this contract because our contract expired on September 30th. We started bargaining with Kaiser regarding this contract on July 31st. That's the earliest that they would come to the table with us. We wanted to start bargaining back in April, but they kind of pushed that. So we've been bargaining with them since July. Unfortunately, our contract expired because we were unable to come to an agreement regarding the issues that I'll talk more about. And so we've been on strike since October 21st. So we just on Friday, yesterday, we just finished our 3rd week of striking. However, we continue to want to meet with Kaiser at the bargaining table through the strike. Our goal is not to strike. Our goal is to come, for that agreement. So we will continue. Unfortunately, we have not heard from Kaiser in the last couple of weeks to continue that bargaining, but we're continuing to push and reach out to see when they're ready. We are ready to bargain. So the issues, though, that we're fighting for, our bargaining platform from the beginning has been equity, right? Equity for our patients, equity for our workers. We're fighting for a lot of things, but our three biggest things are equity in workload, right? So we're wanting to make sure that we have enough workers to provide that quality care for these patients. Another piece of that is outside of therapy, outside of seeing that patient one-on-one, there's a lot of vital tasks that we do to effectively provide these services to these patients outside of that therapy room. So that is whether it's charting, finding resources for these patients, compiling, whether it's CPS reports or creating referrals, talking with, our colleagues regarding their care, whatever it is, there's a million things. And at this point, Kaiser is supposed to give us in Southern California 4 hours of patient management time is what we call it, that time that we have, based on net loss for things out of our control. So whether a patient cancels an appointment or no-shows to an appointment, they kind of tap into that. And so typically we're only left with about 2 hours a week to manage all of our patients that we're seeing and do these outside tasks. We're fighting because in Northern California, they were able to get 7 hours a week in their schedule of protected patient management time versus our 2 hours that we end up, a week. And that's very, very different. And it's extremely vital, again, to provide that quality of care. We as therapists are not about just, that assembly line. We are about that quality care. So this is extremely important. So again, the workloads and the time management. Outside of that, we're working for equity in wages, right? Equity in wages with our counterparts in our union, right? In Northern California, in Hawaii, but also equity in wages for the people that are, our same our jobs that we do, but in other unions that Kaiser has as well, that they have provided these wages to. I want to make it clear that we are not asking for anything in this contract that Kaiser has not already given to other unions or other employees under NUHW in other service, other areas. So again, it's equity. These are extremely important, to us.
Right. Wow, that is crazy. They're willing to.
I'm sorry. I left out one huge thing. I'm so sorry to interrupt you. The last thing of the three big things is also pension. Our pension. They back in 2015, Kaiser. 2014. Anybody hired in 2015 afterwards in our union specifically was not going to move forward with a pension. So we are fighting to get that. At this point, that's about 1,700 of us that no longer have the pension out of all of Kaiser's employees. So we are fighting to get that pension reinstated as well for all of us. Because again, everybody else has it, whether you are a clerk or a higher management, everybody else within Kaiser has that pension. And so we are fighting to get that reinstated. I'm so sorry for interrupting you. That's one of our big three things.
No, absolutely. Glad you did. Hey, 5 seconds. Just wanted to say that this is only possible because of our donors. If you want to see more of this, then consider donating yourself at tvlr.fm/donate. That really is wild that they're putting patients in jeopardy to keep things from you that they give other workers. That really is incomprehensible. And I don't mean to necessarily wrap you into this, and you don't have to co-sign it, but like this is something that we have been talking about over and over with a lot of these fights, like Boeing and its importance for national security, and how they were willing to risk that to keep things from the workers that they deserve. The longshore, the marine carriers and the longshore strike, like these companies are being so irresponsible, and it, for me at least, raises the question of should they be allowed to own these companies? Are they responsible enough to own these companies, or should we be talking about something like should we be having conversations like about nationalization or turning over ownership over to the workers, to the people who actually do the work and care about the product or service that they're performing, so that these companies cannot leach the blood out of, in Kaiser's case, perhaps literally, out of the services and the people that they're performing them for, and the people that they perform them. It really is astounding, kind of the extent to which these companies are willing to be so greedy. So how are people reacting to the strike in the community and within the union and within the broader labor movement?
So within the union, I'll start there. Within the union, our workforce is strong, right? So we were able to get, we've been talking about this, not planning for the strike, but we've been talking about it since the beginning of this year, right? So what are the issues that we want to fight for in bargaining? What are we willing to do if things don't go well in bargaining, which they haven't, unfortunately? What are we willing to do to fight to get what we want for our patients and ourselves? So at that time, we had about, I want to say it was about 83% of people said, these issues are so important to me. I will fight for and do whatever it takes. And this is going on an open-ended strike to get that done, right? And so we had about, I want to say 80% of our bargaining unit has gone out on strike, and a large number continues to stay out on strike. So we're upset with Kaiser. We're frustrated that we can't get back to the table in bargaining, because again, that's what we want to do. But these issues are so important for us. We are willing to stick it out and do what it takes to fight this. So we are pumped up as a bargaining unit. As far as the community, we have seen so much support from people driving by the picket lines, right, honking for us, or applauding us as we're marching through, the different picket sites. Patients have come out to the line and have spoken or picked up a picket sign and said, I am supporting my therapist, even though, it's affecting me right now. I'm supporting my therapist because this is not right. These issues are not right. This is how it's affected me personally. So we have had nothing but support from the community, our patients, and of course our bargaining unit. As far as Kaiser, we're kind of we've seen a lot of propaganda or different ads that they have put out, unfortunately, with untrue information, incorrect information as far as what we are asking for, what we're standing out there for, what we're striking for. And that's very unfortunate. However, it does not seem to be affecting our bargaining unit, our members, and it does not seem to be affecting our patients, because everyone's still on board for this, which has been so heartfelt and heartwarming, and just pushes us even more.
That is, that's crazy. They're spending money putting ads out into the community.
Yes. So one of them, which I'll tell you. So how I mentioned, we're fighting for that 7 hours of protected patient management time, right? That time to do that quality care. Kaiser recently took out an ad, thousands and thousands of dollars for this ad that said that we were asking for 19 hours of this time, which is like half of our work week, right? Again, we have gone over this, till we were blue in the face, what we're asking for, what that would look like in our schedules. I provided them templates, and they're still putting out this false information to spin that. And it's like, we're out here for our patients, please come meet us where we're at.
Wow. I didn't tell you that I was going to ask you this, and so if you don't know, that's fine. But I'm curious about, in a lot of these strikes, like with Boeing, like with the ILA, these companies. Well, with Boeing, it is a little bit different. The Boeing is not financially in a super great place, although they have made the money. They have made way to spend billions and billions and billions of dollars on stock buybacks and dividends, despite being in debt. But that's not been the case for most of these companies, like for the marine carriers that the longshoremen struck against on the East Coast. They have made $400 billion in profits in the last 3 years, right? There's a similar dynamic in a lot of these cases. Is that is there a similar dynamic here? Like, is Kaiser one of these companies that's raking in the monies? Do you know how much, what their profits have been for the last few years, or is there, like, is one of the things that they're saying is that there is actually, like, there's a financial strain here on Kaiser that we got to tighten our belt, and we're not going to take pay cuts obviously as executives, but somebody has to, and it's not going to. Like, what's the financial situation with Kaiser?
So I don't know the numbers specifically. However, I will say at the bargaining table, yes, their argument against everything that we've been trying to fight for has said, this is an economic issue. This is an economic issue. We have to look into those numbers, which I get. They're a business. However, we also know from the backside that they have billions of dollars in reserve. They are not hurting for money because in their plan to continue care for our patients while we're out on strike, they have hired on what we call, it's a term we call scabs, who have kind of other workers who have crossed the picket line and come in to take these jobs while we're out. They're paying these people $13,000 a week, as well as putting them up in hotels, transportation, food, a week. And so if they hired, I wanted to say like 300 people and the numbers they hired way more than that, but if it was 300 people, it's like $4 million a week. So while I understand from their business sense it's a money thing, they're not hurting. And they have already shown that they have done this again for other unions and other employees for Kaiser. So we're 2,400 people out there. Like, this is what we're asking for. And again, this is your patients are your bread and butter. This is why we are here as Kaiser Permanente, for our patients. So, utilize that money correctly then.
Yes. Here's a question that I'm wondering about, and I think that your answer and some of the terms that you used gives me the answer that I was looking for. But just to explicitly ask it, in other strikes, the unions explicitly say, like, don't cross the picket line, like, don't work don't work the positions that we are striking right now. And I have a friend who is a nurse, who is generally, like, very, very pro union, but she's like, if nurses strike, and nurses should strike if they need to, but like travel nurses should be able to, perform those jobs during the strike without, like, social ostracization or something like that. And now I wonder, actually, she works in California now, if you can believe it, for a union hospital, and she really loves the union, and she's, like, all about it, and this was a long time ago that she told this to us, so I wonder if her opinion has changed. But when you have healthcare workers striking, is that a common ask, or do healthcare workers, do your unions have kind of a different public stance about scabbing, or is it, or do you perceive it as a really bad thing to scab, even if it is a healthcare strike?
Yeah, so we have the same stance, right? We to us, scabbing is, look, we are out here again fighting to improve that care, the care for our patients, right? That is extremely important to us. Yes, we know that in the short term, unfortunately, us being out is affecting our patients. However, the more people Kaiser brings in, the scabs, the longer we're going to be out here and not dealing with these issues. So while people think, well, I care about the patients and I'm going to go in and, do this or that, I understand that, but listen to what we're fighting for, right? And join us in that, so we can get back to the table quicker and fix these issues that we have been saying for years has been, affecting our patients. So join us in that. I guess it's short-term pain for long-term gain for our patients specifically.
Right.
So,
and that's kind of what that's kind of what I told her, when we had this conversation years ago. It's like, well, I understand where you're coming from, and patient care is important and all that. But if nobody scabbed during a nurse's strike, then it would be over a lot quicker, right? And so, the scabs are performing a harmful. They're doing harm, actually, because they're both to the workers and to the patients. Ironically enough, was what I said, and she didn't really buy it, but yeah. So I always had a question about that for nurses union. So appreciate you answering that.
Can I add? Sorry,
yeah,
I was just going to add too. From what we've heard from scabs, as well as some of our other employees that have not never came out to the strike line at all. We have heard that they're not making that big of a difference anyways. They're not providing these patients therapy. They're just doing minimal check-ins with these patients, I guess, for safety checks, but they're not really doing much in there. And a lot of them have actually seen what we are dealing with on a day-to-day basis and have called it quits already and said, for this, I can't do this. It's not working for me, and I've left anyway. So it's not really working out for Kaiser anyways, unfortunately.
Well, there you go. Are there any indications that Kaiser is getting close to buckling?
It's very hard to say. We know that they are affected by this. We've seen, again, we're from patients, from workers that are, still working within on the inside. We're hearing that, the wheels are falling off. It's not going well inside because they need us. They really do need us. Again, these people are not qualified to come in and do the work that we were doing, the back-to-back work. So the other thing is that they met with the Department of Managed Healthcare, came down last week and met with Kaiser to see what their plan was to manage these patients, because again, they're still supposed to be providing these services and should have had a better plan for this. And DMH has found out that their plan is not that great. Patients have been calling and complaining, are refusing to come back and see the scabs. So their plan is not really going well. So they're not budging as far as coming back to the bargaining table with us yet, but I know that their plan is not working on the inside, and I can't see how they can sustain staying out much longer or keeping us out much longer.
It really does seem like scabs are uniquely ill-suited to be therapists. Like, to be a scab therapist seems like a uniquely difficult proposition, just like logistically speaking, aside from the moral stuff, which is bad. And like, it makes you a little bit of a bad person if you scab, but like just logistically, that seems like that would be a hard thing to do well, to be a scab therapist, because of all the, the importance of building relationships in therapy. So, as we round out, I'm interested in what you would tell non-union therapists and other mental health workers about the value of unionization in your field of work.
Absolutely. So unionization is extremely important. As I mentioned before, it's to have that platform, to have that ability to come together and fight for what is right within your clinic or your facility or wherever you're at. It's a ability to stand up to the corporation and fight for what is right. And again, we have these platforms, we have political allies. We are able to get this message out there within being in this union. We stand together, and it's extremely important, whether you, again, are a 5-person agency or thousands and thousands of workers. I really recommend being in that union, again, to fight for your patients and to fight for yourselves and make sure that your workload, what you're doing is you're protected. You're protected, and it sustains you, right? The turnover rate within Kaiser is incredible as well because of what is happening. And so we're able to work on these issues and have people support us, our union staff to support us. So I would say it's extremely important. Do it. Unionize.
All right, there you go. Jessica Rentz, therapist at Kaiser, member of the National Union of Healthcare Workers, steward and bargaining committee member. Thank you so much for your time. Is there anything else that you want to make sure that you leave our audience with before we let you go?
I just appreciate it. Thank you so much again for having me on here to be able to discuss these extremely important issues. But I just want everybody to know we appreciate your support from wherever you are. And if you find that these issues are going on in your workplace as well, stand up and do the right thing. And again, just appreciate everybody's support. Thank you.
Thank you so much, Jessica Rentz. Thanks again. You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.